This is why I wanted Shannon on it. She just has such a great way of explaining this stuff, and she's got a really like techie brain, sciencey brain.
Yeah, sometimes.
Hi, I am Kim Peters, and welcome to the Illumine Podcast, where we talk about women in business. We talk about health, aesthetics, hormones, and anything that really relates to being a woman and our busy lives. Today, we're going to be talking about Morpheus 8, which is microneedling with radio frequency, two big buzzwords we hear in aesthetics nowadays. And today, I have with me Shannon.
I'm Shannon Burge. I am a nurse. I work as a clinical director for InMode Aesthetics.
And InMode is the company that has created and made Morpheus 8.
Yeah.
Okay. Hey, sorry to interrupt. If you or someone you know is interested in building your confidence and feeling like your best self, both inside and out, I encourage you to visit Horizon Med Spa and Wellness in Kansas City. We have 2 locations in Shawnee and near the Kansas City Plaza. We offer so many different things. If you would like to check us out, go to horizonmedspaandwellness.com, or you can see us on Instagram at horizon_medspa_wellness. And now back to the show. I am a practice owner. When I started my practice, I really just started with medical weight loss and Dysport or Botox. And as I grew, I realized that there were some gaps in the patients, gaps in terms of like being able to give patients results that they were looking for that I wasn't able to accomplish with those things. So in comes a rep from InMode, and they sell me this lovely device called Optimus that had this handpiece on it called Morpheus 8. So at the time I'd heard about microneedling, or I understood what microneedling was because I had a skin pen at the time, but I had heard this buzzword called radio frequency. It's been a really great adventure in terms of like what I've been able to do to change patients' appearance and also how they feel about themselves. But I want to kind of dial this back a little bit and talk about microneedling specifically and then radio frequency. So microneedling in and of itself, what we're doing, and correct me if there's anything you can add to this.
For sure.
Microneedling is a controlled injury in the skin. So we are puncturing the skin, and the skin's numbed, so a patient doesn't feel anything. The needle is puncturing the skin, and it's stimulating an inflammatory response in a way that we want it to do. So there's no scar tissue formation, but we do have healing of the skin in a way it creates new elastin, new collagen, which are kind of like the fountain of youth for skin. If we can create more of that, the skin looks more youthful. So we've got microneedling in and of itself, great treatment. And then we add radio frequency. Can you tell me a little bit about what is radio frequency?
Yeah.
How would you explain it?
Well, radio frequency is an electrical current, and we're going to use it in a way that it will heat up tissue. So we're going to use microneedles, really fine microneedles with the Morpheus. Those are going to enter the skin. We're going to deliver a radio frequency pulse, and that radio frequency pulse is going to heat up the tissue in the area.
Okay. And so then what happens when the tissues heat up? What's different when we're adding that to microneedling?
So essentially, it's going to break down the collagen. So sometimes I like to think about it as like an egg in a frying pan. Mm-hmm. When we crack the egg open, all of those runny collagen fibers in that frying pan are going to start to congeal together. And essentially, collagen is a spiral, so it's going to basically spiral onto itself and cause a damage. And then the body is going to say, hey, I've been injured. There's a thermal injury. There's essentially a burn there, and it's going to come in and repair that collagen on its own.
Oh, I love that explanation. I love analogies because for me that better explains it, but I use analogies all the time in my practice to help people understand that. So it's heat, essentially. Mm-hmm. And we've got the action of the microneedling where we're injuring the skin, and then we're adding this heat. So we're kind of essentially further injuring the skin, but still in a controlled manner so that we are going to produce more collagen and more elastin. Right?
Exactly.
So one of the things I really like about Morpheus is that it can be applied to different depths. We can do 0.5 millimeter, which is really just the surface, 1 millimeter, 2, 3, 4, 5, or even as deep as 7 millimeters. Now that seems a lot, and I think people think of it as in inches. It's not inches, it's millimeters. It's really, really, really tiny. But in terms of the layers of the skin, it makes a big difference about where we're applying that heat. So what are kind of the different things that we can do? How can we apply this differently to the different depths of skin?
When radio frequency meets tissue, the way it heats up tissue is through resistance, through impedance. So the resistance that it's finding in that tissue is called impedance. And radio frequency is going to flow differently in different types of tissue. So we have different modes that we can use in order order to heat up the dermis differently, heat up the fat differently in order to achieve what we want to achieve, whether it's skin tightening or contouring.
I love that. This is why I wanted Shannon on it. She just has such a great way of explaining this stuff, and she's got a really techie brain, sciencey brain. Yeah,
sometimes
sciencey brain. Okay, so we can apply it to skin, and then we can apply it to fat. So what happens in the skin is it's creating more of that collagen, right? So we're getting better texture, better tone. We're reducing pore size. We're changing the surface of the skin so that if it's dull or kind of crepey, we're changing that so it looks better. Really, we're just kind of introducing more, lack of a better word, I'm trying to think of it like youth, better structure to the skin.
Baby skin.
Baby skin, correct. And really, I mean, if you think of it that way, we're really kind of reversing the clock a little bit. And then when it's applied to the fat, what is it doing to the fat?
Causing a thermal injury in that fat cell, that the fat cell is the membrane of the fat cell is going to basically collapse, and the body's going to come in and clear up that fat debris on its own.
Okay, so that sounds wonderful, right? For all of us that have a little fat somewhere where we don't want it, if we can collapse a fat cell and eliminate it and get rid of it, think about all the places you could apply that. Now, in some cases, we don't really want to get rid of fat. If you think about somebody that's lost a lot of weight, they've lost fat, and then their face or parts of their body look a little bit more aged because fat is actually part of what makes our skin look a little bit healthy. It gives it some thickness, and so we want some of that, but then there are areas that we don't want it. So an example of an area where we might not want fat would be under the chin. We call it the submental area. Or as people age, they might find that there's more volume in their lower face than the upper part of their face, and they might want to eliminate that. So we can adjust Morpheus 8 settings to shrink fat in areas that we don't want fat. And then we can apply it to areas that really we want to keep the volume there, such as like the cheeks, the chin. We don't want to take any volume away from the upper part of the face. And we can apply kind of like the skin changes settings to those parts to improve the texture there. So that kind of leads me to something that I've seen online and social media is that people are talking about how, oh gosh, Morpheus ruined my face because it took away volume in my cheeks. What do you think happened there?
Probably too deep of energy delivery as well as too much energy delivery. When we're dealing with the dermis and epidermis, there's a really high resistance or a higher impedance. So you can use lower energy levels in that area, much safer with still the same efficacy. When we want to treat fat, we're going to go deeper and we're going to increase that energy level. So the deeper we go, the more we increase that energy. Fat's going to have a lower impedance, so the energy is going to flow better through it, so we can use more of it. Safely to cause that apoptosis. So they were probably using too deep of energy, too high of energy.
Right. So really the moral of the story is if the technology is used correctly and you have a provider or practitioner who is utilizing this energy that understands the anatomy of the skin and understands what you want to preserve and what you want to eliminate or improve when trying to achieve a more youthful appearance in the skin. Or face, or even parts of the body. So where can you use Morpheus?
You can use it in any tissue. So
wow.
Anywhere, any soft tissue that we want to coagulate or stimulate new collagen or cause contouring to.
So really anywhere you have skin, I think the only place I wouldn't do it is on the lips. I had somebody ask me once, I went and spoke at a conference and somebody asked me about, could you do Morpheus on the lips? I said, no. She says, well, why not if they're wrinkly? And I'm like, I just don't know that I'd recommend it. I also...
Yeah. I don't know if there's any established protocols to say that it's safe and effective on the lips. But on any other soft tissue would be open and fair game.
I love it. Okay, so it's important that the practitioner knows what they're doing and that we understand what those settings look like to accomplish a certain goal. I didn't really put this on our agenda, but it's kind of stimulated a question. I think Morpheus 8 has been used for some other things outside of just skin texture improvement. What would one of those be?
Anecdotally, there's been providers using it for excessive sweating, armpits, hands, palms, labia reduction, women's health reasons, and women's wellness with the Empower system as well.
So I have both Optimus and I recently acquired Empower, which is the women's health platform. InMode was able to really take this technology of microneedling and apply it to women's health, so vaginal health, that has both a medical purpose as well as a aesthetic purpose. So So women, when their hormones are declining, they're going to have changes in their vaginal health as far as laxity, lack of lubrication, problems with going to the bathroom where they're having like some incontinence or leakage of urine and those types of things. That Empower platform can help all of those things, as well as maybe you're women that are getting a little bit older and just would like it to look a little bit better, right? Yeah. So we can apply microneedling to that to stimulate collagen there so they can have a more youthful looking, well, the other types of lips. I guess the other types of lips. If someone is looking to getting, like they're interested in microneedling, and obviously microneedling in itself, and then microneedling with radiofrequency. The microneedling with radiofrequency is generally speaking more expensive. You're going to pay a little bit of a higher price tag. And how I explain it to my patients is like microneedling in and of itself is building collagen, improving the skin texture and the tone. But if you're someone that wants more of a skin tightening effect, you're going to need to do radiofrequency. Do you have anything to add to that as far as the difference in microneedling with or without?
In general, regular microneedling is going to be very superficial. So you're looking at superficial layers of the skin when you're remodeling those. With Morpheus 8 and microneedling with radiofrequency, we're getting deeper and we're getting a much more tightening effect to the skin.
Who doesn't want tightened skin? The only people that in my practice, if they're talking about microneedling or they're a good candidate for it, the ones that I'm going to recommend or suggest a microneedling without radiofrequency are really going to be maybe my younger clientele that aren't in a place where they need a lot of skin tightening. Not that Morpheus wouldn't work for them, but maybe they're in college or maybe they're just starting their new career and they don't have a big budget for that. Or acne scarring, Skin Pen does well with that. But you're right on the depth. So Skin Pen goes to 2.5 millimeters. Anything that is really considered over the counter for microneedling, I don't know what the limit is. It's not very deep.
Not deep. It's way more superficial.
Right. So if you buy something on Amazon and you're like, okay, this says it does microneedling, not all microneedling is created equal. So you might be doing more damage to your skin than providing it a benefit. You want to get things that have either an FDA approval or clearance, and you would want it to be done by a practitioner who understands the technology and how to apply it, because you could cause more damage than good. And also, there might not even be a therapeutic effect. You might be doing nothing. You might think you're doing something to your skin, but you're actually not really doing much of anything. Speaking of which, Morpheus 8, I know a lot about that one because that's the one that I use. But what about other microneedling devices with radiofrequency? How would you compare those, or do you have anything to say about that?
Yeah, I would say Morpheus 8 is probably one of the more powerful microneedling radiofrequency devices on the market. It's particular in the way that it delivers the energy. Mm-hmm. Each of the pins is a positive pin, and so all of those needles are going to be delivering a radiofrequency current. Many other competitor devices, the energy is flowing from one needle to the next, so you're kind of losing a little bit of its ablative index and the ability for it to become an ablative device.
So even though it says, hey, we have microneedling with radiofrequency, they might not be all created equal, and they might not be able to give such a therapeutic effect. And Correct. I think, does Morpheus have the deepest?
It does, yeah. Okay. So it has the deepest FDA-approved depth of ability for any device.
And there's two handpieces. There's one that is intended for face or smaller areas, and then there's one that's intended for larger areas, places that might need a little bit more depth to it. So like somebody, like we said, we can apply Morpheus 8 to any part of the body. And one area that's very commonly requested is the abdomen, especially women after they've had babies and that skin has kind of gotten stretched out. They're getting older. They have less collagen production. They want to get back to wearing a swimsuit and feeling good in a swimsuit, or at least have a little bit of their tummy showing. So Morpheus 8 can be applied to that, and those needles go deeper, so you're going to get more of a therapeutic effect out of using that type of
and likewise with cellulite on the thighs.
That's true.
Like that. Yeah,
I kind of forgot about that. Yeah. So cellulite, many instances, is just a skin laxity problem. Mm-hmm. So if we can improve the skin laxity, we can improve the appearance of cellulite. Yeah. What about, so everything that we've talked about so far is great about Morpheus, right? So like, it does all these wonderful things. It's the best device, blah, blah, blah. But I wouldn't be naive in saying, like, can bad things happen with microneedling with radiofrequency?
I think minor complications can happen with any medical device on the market.
Yeah.
We're studied and we're proven to be safe and effective for the general population, but there are contraindications to the procedure, and there always is a risk that someone might have a a more pronounced effect as far as an inflammatory effect in the skin that could lead to some complications.
We talked about how we're inducing a inflammatory reaction, and we want that. We want the inflammation. But sometimes inflammation can get a little out of control, and that can make it uncomfortable for the patient, or even the appearance might be unwanted, right? So if you have more swelling, you're going to look more puffy, and nobody really likes to look that way. In my experience, those that seem to inflame more, even though it is a little bit more uncomfortable, they tend to have better results. Yeah. And so it's not necessarily a bad thing. And I think this really comes down to practitioners educating patients on that expectation and understanding, like, we are stimulating inflammation. We want that. And you might be a little uncomfortable, but the result or the benefit out of that is well worth it. From my experience, so I'm also a clinical trainer for InMode. So I travel around the U.S. and train people that have purchased these devices, as well as done some what we call retrainings, where we're just kind of going back and reviewing that education. You know, sometimes bad things happen, but sometimes it's a little bit, I've noticed it's out of a practitioner's control a little bit. We can't predict medicine is crazy in that anything can happen. But also if maybe a patient puts aftercare on, or a lotion or a cream or a retinol or something like that that's irritating the skin, that can happen. Also, you mentioned contraindications. I would think a major one is if somebody has an impaired immune system would be a big contraindication, because the immune system is really, we are relying on the immune system to mount a response so that we can get that therapeutic effect. But also the immune response is creating healing environment for the skin. So we've induced the injury and then we want it to heal. If somebody is compromised, their immune system's compromised in some way, whether it's through medications or a diagnosis, that person is not a good candidate. And I have seen people get treatments where they maybe didn't disclose that to a practitioner.
I think it's important to review medical history.
For sure.
Procedure.
Yeah. And I think a lot of people kind of skip that part. It would be good for a practitioner to have like a checklist of, hey, did I ask all these questions, and maybe give this checklist to the patient. We were talking about this a little bit earlier, and I think it's a good segue into this question. So if somebody they're like, okay, I've listened to this podcast, I'm really interested in getting a Morpheus treatment. What advice would you give them in terms of finding someone that they can trust to do a good job?
Yeah, I think providers should look for, consumers.
Yeah.
Consumers should look for a provider who can easily explain the technology. They can talk about what depths they're treating, why they're treating those depths, maybe look at before and after photos that the provider has of patients of a similar skin tone. Looking for someone who will review their medical history, not really just sell them the treatment. So,
I think that's a really, really good point. So if somebody they're focused on selling you this and saying this is going to be great for you, but they're not asking you questions about your medical history, I think that's kind of a red flag.
Yeah. I think there's a lot you can find out in a consultation. The provider can find out about the consumer, and the consumer can find out about the provider. Setting realistic expectations. It's not a miracle. It's not going to be surgery. It's going to be multiple treatments in a series that's going to get you the best results, and very transparent pre- and post-care instructions. So that's going to make it clear that they know what they're doing, and they know what you should do to prep your skin and what you should do after to have the best results.
Yeah, and I think expectations are really important. So it isn't surgery. It's not a facelift. But I think there are a lot of people that are either not candidates for facelift or don't want one or can't afford it, because they're really expensive, especially the good ones. Morpheus is not going to give you a facelift. However, what it is going to do is closer to a facelift than not, I guess, is what you're saying. Like, it's going to improve. It's going to tighten the skin. What it also is going to do that a facelift can't do for you is it's going to improve the texture and tone of the skin. So if down the line you need to get a facelift or a neck lift, it's much nicer to pull pretty skin than it is just to pull old skin. I had the privilege of shadowing a plastic surgeon who did a facelift, and I got to watch the whole thing. And I was floored. Like, I understand tissue depths. I need to be able to do what I'm doing. But I was floored at how thin that skin was when he was pulling it. Like, you could see light. I mean, it was almost translucent how thin it was. And it really got me thinking about, wow, like, really testing the skin, the depth of the skin. I really think that another thing is, like, a practitioner should be like pinching or touching your skin with washed hands, but like pinching and touching your skin to feel the quality of it and the thickness of it. Anyway, I just thought it was really fascinating to watch a facelift and see.
I think skincare companies have done this for a long time, and the way they've marketed things of, if you create healthier skin, your skin responds better to other things. And Morpheus 8 can do the same thing. So when we create healthier tissue is going to heal better. So if we're creating healthier tissue through those controlled injuries, then it probably is going to heal better with any sort of subsequent surgery down the road.
And you mentioned that it's a treatment series, which I agree with. We recommend in most scenarios at least a treatment of 3, series of 3. And then maybe more if they need it. I really, can you get improvement from 1? Sure. But 1 is not a third of 3 in terms of Morpheus. You're going to get some improvement, but you get a larger percent of that improvement with the second and a even greater percentage of improvement with the third treatment. It's just how it works and how we build the collagen. When would you expect to see results from a Morpheus treatment?
You might start to see some results as far as superficial textural improvement within a couple weeks, maybe 30 days. But that full collagen repair, it's going to start to take effect at around 30 days, and it's going to peak at around 90 days. It's going to take a solid 3 months after maybe that third treatment to see final results.
I tell patients 6 months, and I do this because it doesn't stop at 3 months. It continues, and it doesn't even stop at 6 months. And when I started doing Morpheus treatments on patients, I liked it. I liked because it was 1 month, 3 months, 6 months. I was like, okay, I see some improvement with this. I like it. Patients are happy with these results. When I started having patients come back a year later is when the wow factor kicked in. And I had patients come in for their annual treatment because we do recommend that after you do your treatment series of 3, do at least once a year. I was putting their pictures together. And my most impressive results from Morpheus are a year from when they started the treatment. I think for some people, they might find that discouraging, like, oh, I'm going to put all this money and this time and this effort into it, and I'm not going to see results for a year. But here's the good news about that, is Morpheus is preventative in one way, in some way you could say, is that you are going to reap the benefits of this treatment forever. And so I tell patients, like, okay, so you're marching through time, and I'm going to take you and I'm going to push you back on that time clock a little bit. You're still going to march forward because I can't stop that, right? You're still going to age, but you're never going to just snap back all the way to where you would have been if you hadn't done anything. That's something that like maybe Botox is going to do, right? Once it wears off, you go back to where you started. Morpheus, you're always going to be in a better place than you would have been. So it's great news for people that are looking for something that's more natural, that's going to last longer. Yes, there's a initial investment, but the benefits that you reap from that in the long term are so much better than some other things that we offer in aesthetics. So I think it's really kind of like, I've said it before, it's like this fountain of youth. I love Morpheus.
Yeah.
Combination treatments. So if I have somebody that comes into my office and they're interested in a few different things. We'll say, I don't like my skin texture. I don't like my wrinkles. I feel like my skin is looking old. But they also tell me I have some sunspots that I don't like, and I've lost volume in my cheeks or something like that. I usually don't say it that way. They just say I look old. What are some things? I look tired. I don't look like myself. What are some things that I think this is great news. You can actually combine Morpheus with other modalities. What are some things that you could combine it with?
You could combine it with the CO2 laser for that texture to give a little bit more improvement to the texture and tone of the skin. You could apply it with IPL. So if they have sunspots or age spots, freckles, maybe some rosacea, blood vessels in the area, just overall sun damage, IPL or the Lumecca on your Optimus platform is going to pair really nicely with Morpheus. You could also, InMode has other surgical procedures, quantum, face tight, body tight. Those are all going to pair really nicely. And then your injectables. Morpheus, if you do have volume loss in certain areas like the mid-face, but maybe a little bit of laxity now in the lower face and submentum, then, put some volume in the upper face and treat them in the lower face for that laxity.
There's often, when somebody's coming in with these complaints that we just talked about, there's often multi-factors that we need to address. And what I love about combining it with CO2 or IPL is that CO2 and IPL are going to you're going to see a result from that a lot quicker than you will with Morpheus. So it's really gratifying I'm combining these two. I'm addressing two things. I'm addressing skin texture, I'm addressing pigment, and I'm addressing the skin tightening, like getting the skin to tighten and look more youthful. So I'm addressing all of those things. And yes, some of that skin tightening effect is going to take a little bit of time, but along the way, I get to reap the benefits of skin texture improvement. The sunspots are going away.
It gets them motivated for those improvements too, to keep going and
it just
do more treatments.
Feels better because Morpheus isn't wonderfully comfortable. Okay, it's tolerable. You can make it tolerable, but I mean, it's a little spicy. Thankfully, it doesn't last very long. The treatment's not very long. And as soon as you're done, you're done. It's not uncomfortable after that. But it takes a long time. You've invested your time. You've invested your money. You've invested some downtime. And it's a bit uncomfortable. So you want to reap some benefits from that. So combining it with something that's going to show some results a little bit sooner is really gratifying for the patient, but also me as a practitioner, because I feel good that I'm giving them something that they can
walk away with.
About. Yes, exactly. Yeah. To your point about filler, so Morpheus can reduce volume in areas that we don't want volume anymore. In areas that we need to thicken the skin a little bit to give it a more youthful, so more collagen, it can do that. But as far as like restoring like fat volume, we can't do that with Morpheus. So that would be filler. InMode has kind of coined this term where you're getting the Tighten Bright, which is what you do in IPL, which is going to brighten the skin and fix the pigment. And then Morpheus, which is going to tighten the skin. I kind of added Perk on mine, which is adding a little bit of filler after you finish your treatments. Nice. So Tight, Bright, and Perk. Perk is going to add some volume to the cheek. It's really a very well-rounded result that patients are really happy with when we can combine those. And then the surgical ones that we talked about. So if somebody has more volume that maybe is a little more difficult for Morpheus to tackle, yes, Morpheus can reduce some fat. However, combining it with Face Tight or Quantum, it's a more, would you say, aggressive version of radiofrequency?
Yeah, and it's much deeper. So we're putting that radiofrequency into that subcu plane, subcutaneous tissue, and that's going to cause more apoptosis or that fat cell death in those areas.
Right. So we're going to have more shrinkage of fat. And with a Face Tight, you can actually suction the fat out like liposuction. With liposuction, you're removing the fat, but you're going to be left with loose skin. When you're combining Face Tight or Quantum with liposuction, you're removing the fat, so you're getting that immediate volume change, but then you're tightening the skin over it, so it suctions really nicely over that area so that you're not left with loose skin. And then we do a Morpheus over it, which is going to further stimulate that collagen and tighten the skin so you get more of that overall whole comprehensive benefit of tightening and volume reduction. Some of my most common patients are those that have lost weight recently, which I think is very common in this industry right now with the medical weight loss. In your position as a director, have you seen a lot of discussion about that, about Morpheus and weight loss?
Absolutely. And I think it's a good conversation to have with your patients as you're introducing those weight loss medications, is because anytime we have some volume reduction in the area, you're probably going to see some skin laxity. Now, there is a chance if they're young and healthy, then they might see some just natural, tightening as they lose weight. But, if you're pushing into your 30s, 40s, and depending on the amount of weight loss that you've had, you're going to see some skin laxity in that area. So being preventative with Morpheus 8 or being preventative with any energy-based device is really important to help stimulate that collagen to tighten in that area.
I've had some patients that say, like, they come in and we talk about all of these things. And because if they're starting on, because we offer medical weight loss, if they're starting on a program that's going to help them lose weight, yes, you are going to lose weight. And here are some of the things that you're going to notice that might be less than optimal for you, is that you're going to see changes in your skin that you might not like. You're going to see more wrinkles. There's some contour to your body that's going to change. In most cases, you're going to love that change. But in some spots, it's not. Maybe there's some stubborn fat in the belly area or around the hips or love handles. For certain people they've said, like, okay, well, I'm going to lose weight first, and then I will look into doing Morpheus, microneedling, or Quantum or such. Unless somebody is grossly overweight, which most of my patients are kind of in that middle area, because the results take so long, I prefer to actually start applying that technology at the beginning, because it is so much easier to prevent something than it is to reverse it. And I think that's true for anything, but especially in aesthetics, it's so much easier to prevent. So I would recommend that if somebody is, I'm going to lose weight, I'm looking forward to this, but I do understand that I'm going to have some laxity. Maybe their tummy doesn't look great now. And they're like, well, I understand it's probably going to look more wrinkly as I'm losing weight because I'm losing that fat in the skin. Starting Morpheus when you're starting your weight loss journey is, I think, you're going to get a better result overall.
I think so too. Yeah.
So we've talked about kind of what for consumers, somebody who's looking for a Morpheus 8 treatment. And I hope some of this audience is also practitioners who have Morpheus 8, that they could learn something about how to explain it to their patients. What are some key components that you could give advice to a practitioner as far as being able to offer or at least apply this to their patients? For example, like understanding skin anatomy.
Yeah, knowing where you want to apply that energy and how you want to apply that energy. We can utilize Morpheus 8 to where it just delivers a single pulse. We can also deliver multiple pulses in one same spot. You'd want to know where you're applying that energy, how you're applying the energy in order to both be safe and efficacious for your patients.
Right. So basically, we want practitioners to understand who have Morpheus or are thinking about getting it, to not only understand skin anatomy, which they should in the first place, but to understand the technology. Yeah. I do think Morpheus 8 technology, when you first learn about it, is a little intimidating, but it's because it does so many cool things.
Yeah.
And if you're going to apply to really understand the technology and how it works, once you understand that, you don't really need any support after that because you can really just apply it anywhere. So for someone who is a practitioner that is looking for somewhere to get some more education on this, what would you recommend they do?
Reach out to InMode. You can reach out to InMode. You can purchase additional training. We have amazing trainers who can review. A lot of times, too, when they get the device, they're very overwhelmed, right? I'm sure maybe you
I've
can.
Got a story, yeah.
Yeah, you can relate to this. But, you get the device. Maybe you're brand new to energy-based devices. Maybe you offer some other aesthetic treatments. Maybe you don't offer aesthetic treatments, and this is your first kind of entryway into aesthetics. You're worried about marketing the device. You're worried about selling the device to your patients. You're worried about staff knowing it if you have staff. So there's all these other worries that are kind of going in, how you're going to pay for the device. And you're not so focused on how am I going to apply this to my patient. And then once you start treating a couple patients, you start to have some questions. The company is always, available to offer additional training if people need it. We have a clinical hotline. People call in and ask us questions all the time on the clinical hotline as far as, clarification on different modes.
I think InMode is incredibly supportive, honestly. In my experience, it has been as far as like helping out with understanding things. And then we started, when did we start it? Was it this year?
Yeah, February, I think.
Gosh, yeah, you're right. Okay, so we heard that, there was a lot of people that were InMode users or Morpheus users that like, hey, we would like some more education on this. And so we created this thing called the InMode Institute that primarily, we do talk about other modalities, but primarily talks about Morpheus. And it has been a huge hit. The feedback that I've gotten from everyone about better understanding the technology. And for me, that's my drug, I guess, that I seek when I'm teaching, is that seeing a light bulb go off in somebody's head when they finally understand something that they've been struggling with. It's so gratifying to me. And I really think that InMode Institute has hit the nail on the head. So if somebody has Morpheus 8 and they're offering it and they would like to better utilize this technology, how would they find out about the InMode Institute?
Yeah, they can reach out to their sales rep or account manager. They should know a list of dates in the region or throughout the U.S. that we host them. Usually there's a couple every quarter in different regions within the U.S. So if it's local or if you want to travel to one, you can reach out to the rep and find out more.
It's not expensive. I think it's really just kind of covering the cost in general, and it's very affordable. It's not like thousands of dollars, but
it's a full day of education. So pretty much, it's funny, when we started them, we were like, is this really basic information or is it, advanced information? And what we found is there's really no kind of advanced Morpheus 8 settings. What we teach you in the training and what InMode teaches you in the training is effective. It's just not everyone gets all of that information digested.
Correct. That's a great word for it.
So,
I certainly
by going back and rehearing it and being able to think about how maybe you've applied it in right ways, or maybe how you can apply it better to your patients, is important.
I mean, I feel like I'm a great testimony to this because when I first got my Optimus, we did all our training in one day. We talked about IPL and laser hair removal, and we talked about Morpheus. And I was definitely overwhelmed, and I didn't have the digest is like the perfect word for that. I didn't have time to digest it. But once I kind of understand some core concepts of it and really took the time to learn it and understand it, and I got that support from InMode, and I got to a place where now I can speak about it and help teach others. You're right. There's no advanced setting, so to speak. It's just understanding the technology. It's creating that extra layer of anything that you do, right? If you learn to do filler, you learn the basics first, and then you go get some more education and understand it a little bit better. Hormone replacement therapy. I didn't just go to one course. I went to 1, 2, 3, 4, and I just keep layering on. So I think Morpheus is such a cool tool in aesthetics. It's one of my favorite things that we offer. And as a practitioner, I want people to really hone in and learn it really well so that they can also apply that the same way in their practice. Okay, so we have talked about how practitioners can talk to their sales rep and account managers, but we have also started an Instagram, which is called
@InMode Institute.
And if you are in the Kansas City area and you are interested in looking like the best version of yourself, you can visit us at horizonmedspaandwellness.com. We also have an Instagram at horizon_medspa_wellness. We have 2 locations in Shawnee and the Plaza. Both locations we have Morpheus 8 among other modalities that might help you look like the best version of yourself. And if you are not in the Kansas City area and you're interested in Morpheus 8, you can go to inmodemd.com and you can look for
Physician finder, provider finder of, you can put in your zip code and it'll show you all the local clinics that might have the device near you.
Thanks for joining us. We will see you next time. You have a great day.